Diagnosis and treatment of internal medicine 4. Epigastric pain. Epigastric pain is pain in the upper abdomen caused by overeating, worry, anger, or blood stagnation, all of which lead to stagnation of stomach qi. There are 5 types of epigastric pain. Asthenia of the spleen and stomach with a stagnation of cold. The patient suffering from stomachache for years has taken a lot of cold drinks recently, leading to recurrent pain accompanied by vomiting of watery fluid and acid regurgitation, which can be relieved by pressure and warmth. The tongue coating is white and thin, and the pulse deep and wiry. Retinography shows gastric ulcer. Treatment, Group 1. Pishu, letter 20. Weishu, letter 21. Zusanli, stomach 36. Treatment, Group 2. Zhongwan, ren 12. Gongsun, spleen 4. And Weishu, letter 21. These 2 groups of points can be alternately used to expel cold and relieve pain by warming and nourishing the spleen and stomach. First needle Pishu, letter 20, and Weishu, letter 21, on both sides, with the twisting and reinforcing method for about 1 minute, and then withdraw the needles. Then fix the moxa holder and warm both points with moxa sticks for 20 minutes. Zusanli, stomach 36, is needled with the twisting method, and the needles are retained after obtaining the qi. Twist the needle every 5 minutes, and when the pain is relieved, the needles are retained for 15 minutes more in order to consolidate the effect. During treatment, avoid taking cold drinks and eating melons and fruit. Stomach attacked by liver qi. The patient is angry and depressed, resulting in hypochondriac pain, belching, and nausea, and that is a disorder of stomach energy, which is caused by the stomach being attacked by liver qi. The pulse is deep and wiry, and the tongue coating is thin and yellow, while the stomach is sensitive to touch. Treatment, Group 1. Qimen, liver 14, Taichung, liver 3, Zhongwan, ren 12. Group 2, Ganshu, letter 18, Zhongwan, ren 12, and Zusanli, stomach 36. Using these 2 groups of points alternately can soothe the liver, harmonize the stomach, and relieve the pain. First, slightly needle the right side of Qimen, liver 14, with the twisting and reducing method for half a minute. Then withdraw the needle. Needle Zhongwan, ren 12, with even movement. And then with Taichung, liver 3, with the twisting reduction method, then twist the needles every 5 minutes. Retain them for 15 minutes after the pain is stopped. If the gastric pain cannot be relieved, add some ear points such as stomach and Shenmen, heart 7. Rotate the needles with mild or strong stimulation and retain them for 30 minutes with intermittent movement. Food stagnation. The patient has pain and distension in the stomach with nausea and vomiting, which is caused by poor diet. The pulse is wiry and tense, and the tongue is yellow and greasy. The epigastrum is tender. Treatment, Group 1. Zhongwan, ren 12, Zusanli, stomach 36, Gongsun, spleen 4. Group 2. Liangmen, stomach 21, Jianli, ren 11, and Zusanli, stomach 36. These points can be alternately applied to promote digestion and remove stagnated food, regulate the stomach, and stop the pain. With the respiration reduction method, Transversely insert the needle into Zhongwan, Ren 12, in the direction of the umbilicus and retain it in place. Then needle Zusanli, stomach 36, and Gongsun, spleen 4, with the twisting reduction method and retain the needles. Twist the needles one by one and retain the needles for another 15 minutes after the pain disappears. The treatment is given once or twice a day. Stagnation of qi in blood stasis. The patient has had a gastric ulcer for several years. The stomachache is caused by a bleeding ulcer accompanied by tarry stool. The blood test is strongly positive. The pulse is deep and thready, and the body of the tongue is purple with a thin coating. The epigastrium is tender in a specific area. Treatment Group 1. Geshu, bladder 17, Xuehai, spleen 10, Ganshu, bladder 18, Pishu, bladder 20, and Zusanli, stomach 36. In addition, ear points Gan, liver, Wei, stomach, and Xiaochang, small intestine. Treatment Group 2. Sanninjiao, spleen 6, Ganshu, bladder 18, Pishu, bladder 20, Zusanli, stomach 36. In addition, ear points Pi, spleen, and Wei, stomach. Using these two groups of points alternately can promote blood circulation by removing blood stasis, regulate qi, and relieve pain. First, slightly needle Geshu, bladder 17, Ganshu, bladder 18, and Pishu, bladder 20, with an even movement method for 1 minute. Then retain the needles for 10 minutes with intermittent moving. Xuehai, spleen 10, and Zusanli, stomach 36, are needled with the even movement method. The needles are retained for 15 minutes with intermittent movements. Put into the ear points small seeds, which are pressed for about 2 minutes. The seeds may be pressed by the patient himself 3 times a day, with mild to strong stimulation. During the treatment, it is advisable to take liquidized or a semi-liquidized diet and avoid solid food and liquor, as well as hot and overheated foods. Deficiency of the stomach yin. The patient has had stomach problems over 10 years. The deficiency of stomach yin is caused by a lack of body yin liquid, leading to vague pain and a hot feeling in the stomach. The pulse is deep and thready, and the body of the tongue is red with no coating in the center. Treatment Group 1. Ganshu, bladder 18, Weishu, bladder 21, Sanninjiao, spleen 6. Group 2. Taishi, kidney 3, Geshu, bladder 17, Zhongwan, Ren 12, and Zusanli, stomach 36. The 2 groups of points should be alternately used to nourish yin, restore vitality, harmonize the stomach, and relieve the pain. First, select Ganshu, bladder 18, and Weishu, bladder 21, which are needled with the twisting reinforcing method for half a minute. Then withdraw. Sanninjiao, spleen 6, by rotating the needle with the tonification method and retain for 15 minutes. The patient is treated every other day. 8 treatments make up 1 course. It is necessary to have a mild diet, such as gruel, noodles, and bread. Avoid wine and overly hot or cold foods. Vomiting. Vomiting is usually a result of poor diet, depression, and disorders of the spleen, causing adverse rising of the stomach qi. Clinically, vomiting may be divided into 3 types. Vomiting resulting from overeating. This disorder of stomach qi was caused by overeating. There appears acidic vomit and fetid food. There is a slippery and rapid pulse and a yellow and greasy tongue coating. Treatment. Xuanji Ren 21, Xiawan Ren 10, Neiguan Pericardium 6, Zusanli Stomach 36, and Gongsuan Spleen 4. This prescription is used to promote digestion and remove food stagnation in order to stop the vomiting. First, transversely insert the needles into Xuanji Ren 21 and Xiawan Ren 10. Use an even movement method. Remove them half a minute later. Then needle Neiguan Pericardium 6, Zusanli Stomach 36, and Gongsuan Spleen 4. After the qi sensation is obtained, retain the needles for 20 minutes with intermittent moving. The therapy proceeds once or 3 times a day until the disorder is cured. During the treatment, avoid raw and cold foods, fruits, greasy foods, meat, or fish, and take a semi-liquid diet such as vegetables. Stomach attacked by liver qi. The patient's liver is affected by anger, so the stomach is attacked. This leads to adverse rising of the stomach qi. The patient has distension of the abdomen accompanied by vomiting and acid regurgitation. The pulse is wiry and the tongue coating yellow. The X-ray indicates pylorospasm. Treatment. Ganshu, bladder 18, Taichung, liver 3, and Zusanli, stomach 36. These points may be used to soothe the liver, harmonize the stomach, and stop the vomiting. First needle Ganshu, bladder 18, with an even movement method for 1 minute, and then withdraw the needle. Needle Zusanli, stomach 36, with an even movement method. And needle Taichung, liver 3, with the reducing method by lifting and thrusting. Retain the needles for 20 minutes after getting the qi sensation. The patient is treated 1 to 3 times a day until cured. During the treatment, the patient should avoid anger and stay calm. Deficiency of the spleen and stomach. The patient has had deficiency of the spleen and stomach, and his overeating of cold, greasy foods has led to the disorder of stomach qi with vomiting and lassitude of the body. The pulse is weak, and the tongue coating is thin, white, and greasy. Treatment. Pishu, bladder 20, combined with Neiguan, Pericardium 6, and Zusanli, stomach 36. Use these points to strengthen the spleen, roll the middle jiao, and stop the vomiting. Needle Pishu, bladder 20, with the twisting tonification method, and remove the needle 1 minute later. After that, cupping is applied for 10 minutes. Needle Neiguan, Pericardium 6, and Zusanli, stomach 36, with the twisting reinforcing method and retain the needles for 15 minutes with intermittent movement. Treat once a day. 6 treatments are 1 course. During the treatment, the patient should avoid raw and cold foods and indigestive food like dough and fat meat. It is helpful to eat easy-to-digest foods such as porridge and noodles. Diarrhea. Diarrhea is usually due to damp pathogens and dysfunctions of the spleen and stomach. There are 2 types, acute and chronic, which may be further divided into 4 subtypes. Acute diarrhea. Damp cold subtype. The patient has acute diarrhea with abdominal pain, bubberigamus, frequent watery diarrhea, which is caused by contaminated food and cold pathogenic factors. The pulse is slow and the tongue is pale with a thin and white coating. Treatment. Tianshu, stomach 25, Yinlingquan, spleen 9, and Shangjushu, stomach 37. This prescription can warm the middle jiao and promote the qi to remove dampness and stop the diarrhea. Burn 3 cones of moxa with ginger on Tianshu, stomach 25, and at the same time needle Yinlingquan, spleen 9, and Shangjushu, stomach 37, with the lift and thrust method combined with the twisting reduction method. After qi is obtained, retain the needles 20 minutes with intermittent movements. The treatment, twice a day, continues until recovery. During the treatment, it is suitable to take a semi-liquid diet with more vegetables and to avoid raw, cold, and greasy food. Damp heat subtype. The patient is ill with acute diarrhea with abdominal pain and thin hog and fetid stool, which is caused by unclean food, heat, and pathogenic factors. The pulse is slippery and rapid, and the tongue has a greasy and yellow coating. Treatment. Hogu, large intestine 4, Neiting, stomach 44, Tianshu, stomach 25, Yinlingquan, spleen 9, and Shangjushu, stomach 37. These points can be used to clear away heat, remove dampness, and stop the diarrhea. First needle, Tianshu, stomach 25, and Hogu, large intestine 4, with the twisting and reducing method for half a minute. Then butcher Yinlingquan, spleen 9, Shangjushu, stomach 37, and Neiting, stomach 44, with the twisting reduction method by lifting and twisting. Retain the needles for 30 minutes with intermittent movements. Treatment is given 2 or 3 times daily. During the treatment, it is advisable to take a semi-liquid diet with vegetables and avoid ginger, fruit, meat, and fish. Chronic diarrhea. Spleen deficiency subtype. The patient has diarrhea 3 to 4 times a day, abdominal distension, and poor appetite caused by spleen and stomach deficiency and the dysfunction of the spleen in transportation and transformation. The pulse is weak and the tongue is swollen with a white coating. Treatment, Group 1. Pishu, letter 20. Qihaishu, letter 24. Dachangshu, letter 25. Group 2. Zhongwan, Ren 12. Zusanli, stomach 36. Tianshu, stomach 25. And Qihai, Ren 6. These 2 groups of points are alternately used to strengthen the spleen, conserve the qi, and stop the diarrhea. First, needle Pishu, letter 20, with the twisting and reinforcing method by lifting and thrusting for half a minute. Then withdraw. Then puncture Da Chang Shu, letter 25, and Qi Hai Shu, letter 24, with the same method as above. Burn 4 cones of moxa on Pishu, letter 20, and Qi Hai Shu, letter 24, with a thin layer of drug paste between the skin and moxa. Treatment is carried out once a day or every other day. 10 treatments constitute 1 course. Raw, cold, and unclean food should be avoided. Kidney deficiency subtype. The patient is affected by diarrhea before dawn with intolerance to cold and abdominal pain, which is caused by a kidney yang deficiency. The pulse is deep and thready, and the tongue is pale with a white coating. Treatment, Group 1. Ningmen, Do 4. Shen Shu, Letter 23. Qi Hai Shu, Letter 24. Group 2, Tai Xi, Kidney 3, Tian Shu, Stomach 25, and Qi Hai, Ren 6. These 2 groups of points used alternately have a proven effect for warming and conserving the kidney yang, reinforcing the qi, and stopping diarrhea. Moxibustion with a Tai-E moxa cigar is adopted. Attention should be paid to the temperature of the cigar. If the temperature is too high, cover the point with cloth. Each moxibustion lasts for 15 minutes once a day or every other day. 10 treatments make up 1 course. During the treatment, it is necessary for the patient to keep himself warm and avoid raw and unclean food. Constipation. Constipation is defined as difficult bowel movements or failure to pass the stool for over 48 hours. It is usually due to qi stagnation, deficiency of qi in blood, or stagnation of yi in cold, which leads to disorders or transportation problems in the large intestine. Qi stagnation. The patient habitually passes the stool every 3 or 4 days, and belching and distension of the abdomen are present. He has a wiry pulse and a thin, greasy coating on the tongue. Treatment. Qi Hai Shu, Bladder 24, and Da Chang Shu, Bladder 25, which are good for regulating qi. Shang Ju Xu, Stomach 37. This prescription is adopted to strengthen the qi, eliminate stagnation, and relax the bowels. Perpendicularly needle Qi Hai Shu, Bladder 24, and Da Chang Shu, Bladder 25, with a twisting reduction method by lifting and thrusting for 1 minute, and then withdraw the needles. Following that, Shang Ju Xu, Stomach 37 is punctured with the same method, and the needles are retained for 20 minutes. A course consists of 10 treatments once a day. Qi and blood deficiency. The patient has developed constipation accompanied by dizziness, palpitation, and a pale complexion. The pulse is deep and thready, and the tongue is pale with a thin coating. Treatment. Pishu, Bladder 20, Tian Shu, Stomach 25, Zhu Sanli, Stomach 36, and Da Chang Shu, Bladder 25. These points needled with a conserving method can nourish spleen and blood, reinforce qi, and relax the bowels. Perpendicularly insert the needle into Pishu, Bladder 20, and Tian Shu, Stomach 25 with the twisting tonification method by lifting and thrusting for 2 minutes, and then remove the needles. Tian Shu, Stomach 25, and Zhu Dosanli, stomach 36, are perpendicularly punctured with the twisting conserving method for half a minute, and the needles are retained for 15 minutes. The treatment is given once a day. 8 treatments are one course. Cold stagnation due to excessive yin. The patient feels chilly with abdominal pain and constipation. The pulse is deep and slow, and the tongue is pale with a white greasy coating. Treatment: Ciliao, bladder 32, and Da Changshu, bladder 25. These points are either needled with the tonification method or given warm moxibustion, which warm the yang and expel cold, remove stagnation, and relax the bowels. Ciliao, bladder 32, and Da Changshu, bladder 25, are perpendicularly punctured with the conserving method by lifting and thrusting for half a minute. The needles are warmed by 3 cones of moxa. Treat once daily. 10 treatments constitute one course. The patient with constipation should take more vegetables and fruits and do some exercise outdoors. It is important to pass the stool every day. Diabetes. Diabetes is characterized by polydipsia, polyphagia, polyuria, and even emaciation. The glucose in the urine is positive, and the blood sugar is high. There are 3 types of diabetes. Diabetes involving the upper jiao. The patient feels thirsty frequently and drinks a lot. There is an excessive appetite with frequent urination. The test of urine glucose indicates the blood sugar at 150%. The pulse is rapid and wide, and the tongue is red with a thin yellow coating. Treatment: Xinshu, bladder 15, Yishu, extra point. Those are the main points for diabetes. Yuji, lung 10, Lianquan, ren 23. These points are used to clear the heart fire, nourish the lung yin, and stop the thirst. Snatley needle Xinshu, bladder 15, with the twisting reduction method. And needle Yishu, extra point, with an even movement, and withdraw the needles after a half minute of twisting. Needle Lianquan, ren 23, with the even movement method for half a minute, and then pull the needle out. Yuji, lung 10, is punctured with the twisting reducing method, and the needles are retained for 10 minutes. The treatment is required once a day or every other day. 10 treatments are one course. Diabetes involving the middle jiao. This diabetes is characterized by a very good appetite and frequent hunger, accompanied by polydipsia and polyuria. The glucose in the urine shows 2+. The pulse is vague and fast, and the tongue is dry with a yellow coating. Treatment: Pishu, bladder 20, Hegu, large intestine 4, Neiting, stomach 44, and Yishu, extra point. This combination of points will clear the stomach fire, relieve thirst, and regulate the spleen. First, needle Yishu, extra point, and Pishu, bladder 20, with an even movement method for 1 minute, and remove the needles. Both Hegu, large intestine 4, and Neiting, stomach 44, are needled with a twisting reduction method, and the needles are retained for 20 minutes with intermittent movements. Treatment is given once a day or every other day. 10 treatments constitute one course. Diabetes involving the lower jiao. This type of diabetes shows the passing of clouded urine frequently, with dizziness and poor vision. The patient drinks a lot and often feels hungry. There is low back soreness and distension. The glucose in the urine shows 3+, and the blood sugar is 270% mg. The pulse is steady and rapid, and the tongue body is pale. Treatment: Shenshu bladder 23, Taixi kidney 3, and Yishu extra point. This prescription is used to eliminate heat from the liver and tonify the kidney, nourish yin, and relieve thirst. First, puncture Yishu extra point with an even movement method for half a minute and retain the needles. Shanshu bladder 23 is needled with a twisting reinforcing method for 1 minute and the needles are retained. Taixi kidney 3 is needled the same way. The needles are retained for 20 minutes with intermittent movement. The patient is treated once daily or every other day. 10 treatments make up one course. During the treatment, the patient should control his diet by eating more vegetables and coarse grains and by avoiding greasy and sweet food. Alcohol is prohibited. Impotence. Impotence, namely the failure of the penis to erect or to reach potent erection, is usually caused by sexual neurasthenia or prostatitis. Kidney yang deficiency. The patient has developed impotence caused by daydreaming, lassitude, and intemperance in his sexual life, which has led to kidney yang deficiency, dizziness, tinnitus, aversion to cold, and lassitude of the loins and legs. The pulse is deep and thready, and the tongue is pale with a thin coating. Treatment: Group 1. Ningmen, Do 4. Shanshu, bladder 23. Shangliao, bladder 31. Group 2. Guanyuan, Wen 4. Dahe, kidney 12. And Sanyanjiao, spleen 6. These two groups of points can be alternately used to tonify the kidney yang. Perpendicularly needle Ningmen, Do 4, Shanshu, bladder 23, and Shangliao, bladder 31, with a twisting reinforcing method, and retain as well as warm the needles with 2 cones of moxa. The treatment is given once daily or once every other day. 15 treatments make up one course. During the treatment, the patient should refrain from sexual activity and relax as much as possible. Seminal emission. Seminal emission refers to ejaculation without sexual intercourse. Ejaculation resulting from dreaming is called nocturnal emission, and spermatoria occurs at daytime. Nocturnal emission. The patient of this disorder tends to ejaculate in sleep, has dizziness, tinnitus, lassitude, and low back soreness. There is a thready and fast pulse, and the tongue is red with a thin coating. Treatment: Group 1. Xinshu, bladder 15, Shanshu, bladder 23, Zhishi, bladder 52, Taixi, kidney 3. Group 2, Guanyuan, Ren 4. Dahe, kidney 12. Taixi, kidney 3. And Shenmen, heart 7. These two groups of points are alternately used to clear the heart fire, tonify the kidney, and stop the emission. Slightly needle Xinshu, letter 15, towards the spinal column with a twisting reduction method for 1 minute and remove the needles. Zhishi, letter 52. Shenshu, letter 23. And Taixi, kidney 3, are perpendicularly needled with a twisting reinforcing method by lifting and thrusting, and the needles are retained for 20 minutes. The treatment is carried out every day or every other day. 8 treatments constitute 1 course. Spermaturia. The patient's sperm is emitted spontaneously while awake, and he often feels tired with palpitation and impotence. The pulse is deep and weak, and the tongue is pale. Treatment, Group 1. Mingmen, Do 4. Yao Yangguang, Do 3. Combined with Shenshu, letter 23. Zhishi, letter 52. And Taixi, kidney 3. Group 2. Qihai, Ren 6. Sanninjiao, spleen 6. Guanyuan, Ren 4. Dahe, kidney 12. And Taixi, kidney 3. These two groups of points can be alternately used to tonify the kidney and stop the emission.
三年胶